Namaste to everyone. Today I am going to discuss around 20 very important points which I think that our healthcare providers and healthcare planners should focus on. So I have written those 20 points and I will be sharing those 20 points with you, with all of you, and I will very much appreciate if all of you can also give your opinion, that what in your opinion should be the focus of our healthcare planners and policy makers in the comment box below. So those 20 points which I have written are: the first, number one, the health budget for both central and state should be made 5 times of existing. We have very minimal allocation to health, with at least a quarter of it going for preventive aspect, the preventive part of the health. Second, focus on preventive health. Fall ill and then come to me is the mantra at present. Don't fall ill and don't come to me should be the mantra of the health sector. Why to fall ill? Why can't we take so much of preventive knowledge that we have, that we should not fall ill? So recently I read an article and I would love to share one line from that article with all of you. The article was in the Hindu newspaper and it was written by Dr. Pratap C. Reddy, the chairman of the Apollo hospitals. He wrote, with India facing a growing epidemic of non-communicable diseases, there needs to be awareness that one can heal before there is a need to heal. So he's so right in saying it. We should focus on preventive health, and we all know there are so many things which we can do to keep ourselves healthy. Let's not fall ill. So the point number 3, preventive medicine by simple lifestyle changes and screening for diseases are hardly advertised. Instead, curative aspect is promoted and advertised. Why? Because commercial interests, corporate interests are always on top. We don't have much of money in preventive medicine, but if we want to make country healthy, if we want to fight diseases in a very nice way, holistic way, the preventive aspect of the health should be focused. Screening to identify diseases at earlier stage. We should not treat diseases when they are advanced. The screening to identify, the health education, the general public should be aware about the early symptoms, early signs and symptoms of the diseases. So here comes the role of the general public health education. Medicines of God are food and nature. See, God has given us medicines also. When God has given us life, so the God has also given us medicines. So what are those medicines of the God? Food and nature, I think, are the medicines of the God available to all of us. And today they are the most neglected. So the medicine of the God are the most neglected things we are having in the world. We all are eating actually garbage. We all are eating junk food, food which has not been grown in a healthy way, what not. The lesser I say, the better it is. So we all are eating garbage most of the times. There is no control of food hygiene in most of our shops. Our youth is eating the unhealthiest food that is possible. So we are completely, and nature, the lesser I say, the better it is. We are simply destroying nature. So our generation is not getting the medicine, the natural medicine that the God has given us, the food, the healthy holistic food, the fresh food that is missing in our day-to-day diets. And simply the nature, we are so far away from nature. Our lifestyle should include hobbies. We should give time to hobbies, yoga, exercises, art and music. They are very important healers. Seasonal and regional food. We should spend time in nature. We should travel a lot. Hobby classes and regular counseling for medicos. This is also very important, that the healthcare providers should be healthy. If the healthcare providers are not healthy, how can they give health to others? Then point number 7 I wrote was, our existing town planning is the right culture medium for microbes. You see, all our existing towns are so overcrowded, so unclean. They are the sun. We are so far away from the sunlight. We are so far away from the fresh natural air in our modern towns. So they are all very good culture medium for microbes, and then so many different kind of diseases. There should be zero tolerance for corruption, but sadly, how many times have we heard the regulatory bodies taking punitive measures against healthcare providers who are corrupt, who are unethical. We hardly listen that the regulatory bodies take any action against them. Compassion and transparency should be there amongst healthcare providers. Having said this, we should also have very strict punitive action against segments of public who try to harm with their malified agenda against healthcare providers. So those who are destroying, those who are, doing violence against the healthcare providers, they should be dealt very strictly. Bonds in healthcare sector should go away, especially for junior and senior residents. They are not bonded laborers. We should make our infrastructure and service conditions so good at different levels of hospitals so that these junior residents and senior residents themselves think of staying there. They themselves giving their services there. Why should we force them to stay? Existing primary health center, community health center, district hospitals should be made infrastructure and manpower rich so that the load on tertiary healthcare hospitals is reduced. 3 tiers health system with proper referral policy in place is must. At present, one of our biggest problems is that our tertiary healthcare centers, our medical colleges, our big hospitals of the big cities, they are overcrowded. Why? Because there is no proper referral system, and the patient doesn't believe in the primary and community health centers because there is lack of infrastructure, lack of adequate manpower. So the diseases which should have been treated there are not treated there, and they are referred to the higher hospitals, to the higher centers, and which leads to these higher hospitals getting overcrowded, and so they are not able to treat those diseases for which they were meant to. So this is a very serious problem that it's a very beautiful hierarchy on paper, but at functional level it is very defective. Paramedic cadre should be strengthened because not everything can be treated or can be, paramedics play a very important role in guiding patients, in teaching patients, in, proper referral systems, in giving a kind of educating public for preventive health care. So paramedics have got a very great role to play in our with our youth population that we have. So paramedic cadre should be strengthened. Integration of different fields of medicine science, medical sciences like Ayurveda and other traditional health system is must. So we need to integrate. There is no doubt about it. What is good in Ayurveda, what is good in other traditional medicines of India should be taken, and our health clinics should not offer only one kind of thing. What is good, what is scientifically proven should be offered, should be given. So integration is very important. Music and art therapy also play a very positive role in many chronic diseases. Music meditation, healing your heart and soul, wellness clinics should be promoted. These are clinics for most of our the non-communicable modern day diseases, which are most of the time actually lifestyle related diseases. We are all seeing epidemic of those diseases: diabetes mellitus, hypertension, insomnia. These are all diseases. Not able to sleep is a disease. Mental issues. Almost every second person is one way or other mentally affected. Then various kind of heart problems, endocrine diseases. All these are modern lifestyle diseases which we see so commonly now. We are seeing an epidemic. The more and more we have controlled communicable diseases, we are seeing epidemic of non-communicable diseases. So, just giving medicines or just doing surgery is not enough for these diseases. We need to prevent these diseases. And once if you have suffered from these diseases, there should be a holistic approach. If a person is suffering tension, if a person is not able to sleep, and we are only giving antihypertensive to that particular patient, we are not serving it. It's not serving its purpose, because the root cause of the hypertension or the root cause of the stress might be something else. So we should target those issues also, the root causes. Then one very important thing is insurance. Health insurance should cover the entire population with equal coverage value, with premiums varying based on the income level. But the coverage should be equal. Everyone has got the equal right to have the best of the health. So, and the premiums can be different depending on their income level. and it should be government supported also. Indian health service cadre should be created for administration of health services in a better way. If we can have Indian Administrative Service, Indian Police Service, Revenue Service, Postal Service, Forest Service, Foreign Service, why can't we have Indian Health Service? And this was there in the past. So we need to think, our administrators should need to think on this issue also. There should be a strong bond and healthy coordination between three wings of health system: health education and research, clinical practice, and health administration. So these are the three wings of health, and they all need to coordinate each other in a very nice way. Then data maintenance and collection with proper computer records. We are often very poor in maintaining our records. Premier institutions with decades of excellence and proven records should be given more liberty in designing their own policies in medical education and research. This is kind of decentralization. It should give more powers to those institutes and those hospitals which have a very, very good track record, so that they can grow more. Of course, there should be a broad guidelines, but it should not be one for everyone in the whole of the India. There should be liberty should be given for designing their own, because this is how innovation takes place. And then green hospitals and colleges should be promoted and made mandatory. So why not? Environment, the nature, as a healthcare provider, it's our responsibility, because if our environment, if our nature is not there, our whole health will go down. So we need to lead by example. We need to have our own house, our own hospitals, our own medical colleges, green buildings. So I think these are certain points which I have written because health is the greatest wealth and bliss. If we don't have health, we have nothing. All our other possessions are of no value if we don't have health. So invest in your health right now. Even if you are a 10 years child or you are a 18 years young boy or a girl, don't think that health is not your business now. Don't think that it is not the time to invest in health. Don't think that one day when I will be 40 or 50, then I will think about health. No, that's stupidity. You should start thinking about your health at whatever age you are, and start investing in preventive health. Don't think that yes, you have so much of money and then you can have the best of the treatment anywhere in the world, so why to worry? No. There are diseases, there are illnesses which you just cannot cure by money. But you could have prevented those illnesses and diseases by just a small penny. So the prevention is so easy and cheap, but you should be aware of it. So let's think on these lines, that we should more and more focus on preventive health. So I hope you like this short discussion. It went a bit long, but I hope you will also write your comments that how our future health should be planned. What is your view? What is your vision on this? Because at the end of the day, we all wish to live in a healthy way. Yes, last but not the least, I would like to enumerate the 8 dimensions of wellness. So earlier it used to be the physical health. So let's start from the physical health. So first is the physical health, then intellectual health, then environmental health, emotional health, financial health, social health, spiritual health, occupational health. So these are the 8 dimensions of health, and all these 8 dimensions should be good for us. We should be in equilibrium with all these 8 dimensions if we want to keep ourselves healthy in a holistic way. So I will again repeat this: physical, intellectual, environmental, emotional, financial, social, spiritual, and occupational. So I wish you, all of you, a very, very nice, beautiful, healthy life, because if you have a healthy life, you have everything else. Thank you so much.